Good evening to all. I am Dr. Asavari Sawant, Public Health Specialist at IHW Council, and I welcome you all to this exclusive Hypertension Awareness Series, an initiative by Integrated Health and Wellbeing Council, powered by Servier. According to the Indian National Family Health Survey 5 of 2019-2021, it is observed that 21% of women and 25% of men suffer from hypertension. 39% of women and 49% of men in India aged 15 years and over are pre-hypertensive. May is the National Health Awareness Month, recognized every year by the Government of India. May is also the May Measure Month, which is the global campaign by International Society of Hypertension. Hence, partnering up with Servier and joining the May Measure Month, Integrated Health and Wellbeing Council has organized a month-long initiative to raise awareness on the growing burden of hypertension, to make people aware on the different aspects of hypertension. This live session, we will discuss on the topic of uncontrolled hypertension in the elderly, for which we have a very eminent panelist here with us. I welcome Dr. Atulya Saurabh. Dr. Atulya Saurabh is the consultant geriatrician at Apollo Sage Hospital, Bhopal and Kasturba Hospital, Bhopal, and has more than 27 years of experience in treating the elderly. Sir, we welcome you to the show.
Thank you. Thank you, Dr. Asavri. Thank you for inviting me to this program and introducing me. Thank you very much.
Thank you. With that, let us start with the topic for today, which is uncontrolled hypertension in the elderly. So we are talking about hypertension in this month-long series and different aspects for raising awareness on what hypertension is, what are its signs, symptoms, and management tips and measures. So coming on to you as a geriatrician, what are the unique challenges that you encounter when managing older patients that are suffering from hypertension?
See, as a geriatrician, my focus is on taking care of senior citizens, be it their blood pressure or their diabetes or their other comorbidity conditions. Or most of the patients, most of the seniors suffer from 2 or 3 different ailments which are chronic in nature. Like most of the people, more than 50% will be diabetic or will be hypertensive or might be having both of them. Along with that, they might be suffering from their lung problems like COPD or asthma, with their bone problems like osteoarthritis or cervical spondylosis and other kinds of bony defects. So when I'm taking care of such seniors who have multiple problems, it becomes all the more difficult to manage blood pressure or hypertension in such people, because when I'm taking care of them and looking after their medical problems, I have to look into all the different comorbid conditions. When I'm treating their hypertension, I have to look into their status of their dyslipidemia, status of their blood sugar levels, what other medicines are they taking. That has to be kept into consideration when we are treating a senior. So that becomes a challenge. You can't just write a number of medicines and the poor fellow is already on another 20, 30 medicines from various different specialists. So my role as a geriatrician comes into play when I have to judiciously and manage their overall medical conditions, all the various medical conditions all put together, bring them down to the minimum necessary medicines, reduce the amount of pills they are taking in, and then we have a control in the blood pressure which is safe for them, as well as will avoid any complications which a hypertensive patient suffers from, an uncontrolled hypertensive patient suffers from.
Yes, certainly. So as you have shared that older people do not generally suffer only with hypertension, have multitude of other diseases as well, and the interaction of hypertension with other diseases also have to be properly noted. So can you please help us understand how common is it for an older person to have various other diseases along with hypertension? I'm sure in your experience that you are seeing all these old patients most of them suffer from multiple different diseases altogether. So how but does it become a challenge while also considering their age, that we do not push our patients to have multiple different medicines or push them to go through various different tests again and again, considering their age, which also becomes a big challenge when it comes to their treatment?
Yes, it does. A senior patient is already compromised. His systems are not working well. They are at a lesser level of finesse. So when I'm taking care of my senior citizens, senior patients, and if they are hypertensive and uncontrolled hypertensive, then in that case I have to see how normal can I bring them to. See, if a patient comes to me with a systolic blood pressure of 180 and a diastolic pressure of 60 or 70, then I have to be sure that uh, whether bringing his systolic blood pressure to 130 or the guidelines like 140, will it be safe enough for him? Will he be able to tolerate such a low pressure or a normal pressure? Because many times as systolic hypertensive patients or isolated hypertension patients, systolic hypertension patients have the chances of going into orthostatic hypotension when you bring down their blood pressure to a normal level and a general normal level. So we have to tailor make the treatment for the individual person whom we are taking care of, whether he is a Parkinson's patient or his other autonomic nervous systems are working well or not, whether he is going to, if I bring his blood pressure down to say 150 or 130 or 140, will he suffer from orthostatic hypotension or a syncope attack, or he might get a dizziness when he's getting up from his bed and may fall down and then injure his hips or injure his and land up with a fracture, which will be more detrimental to him than a little higher blood pressure. So you have to consider all his conditions, his cognitive conditions, his ability to understand the importance of medications, understand the other various factors, which are whether he is taking his medicines on his own or his family members are giving him the medicines. All these things have to be taken into consideration before we plan a treatment for a senior patient. And this is what is the challenge in geriatric practice.
Thank you so much. We will come on to the caregivers aspect later on during the discussion. But as of now, we also wanted to understand that if there is an ideal scenario wherein the old patient is very healthy, it just has only hypertension, no other major diseases, or does not take much medications at all, just multivitamins. And this would be the ideal scenario, and comes to you with a little high blood pressure and wants to get checked. So, can you please help us understand the relationship between simple aging and hypertension? Does aging have a role and naturally makes people more hypertensive or more susceptible to developing hypertension? And how does aging process affects the blood pressure regulation in older adults?
Yes, it does. With age, your bodily functions decline, your muscle mass declines, your arteries become all the more stiff as compared to a younger population. So in seniors, we mostly find ISH or isolated systolic hypertension more common than in a younger population, say in people less than 60 years of age. So that is a challenge. Then their other systems like their kidney functions are compromised, their autonomic nervous system are compromised, whether their cognitive functions are well or not. Just if a person is just hypertensive, nothing else, everything else is fine, then the target would be a better control. So in that case, as the guidelines or the most of the societies, American Heart Society or European Society or Cardiology Society, all of them recommend that the BP should be controlled to as normal as possible, and the levels or the recommendations are same as a younger population. So the like American Heart Society says the BP should be around systolic should be around 130. The target should be around 130 systolic, and the diastolic can be around 70 or 80 millimeter of mercury. But the JNC 8 guideline says it should be around 150.
I think there is some minor network issue at your end. We are just checking on. Yes. Are you able to hear us? Dr. Saurabh, you
Hello.
are. Yes.
Yeah. Am I online? Yeah. So we have to look into the overall condition of the patient is learned enough and can understand and can comprehend the things. We bring down the blood pressure to as near normal the guidelines as possible. Mostly the guidelines recommend the systolic BP should be around 130 to 150 mm of Hg. Target. And we see if the person is not getting any complications or is not getting any adverse effects of bringing down the blood pressure, we bring it down to the recommended range.
Okay, thank you so much for helping us understand that. Now let us move on to the risk factors. I'm sure the aim of this session today is to reach out to elderly population so that they are made aware on the different aspects of hypertension and also to avoid hypertension. So what are the common reasons for uncontrolled hypertension? What makes people more susceptible to developing hypertension? If you can help us understand that.
The genetic makeup, the dietary habits, the lack of physical activity. These are the basic things that make a person more susceptible to being a hypertensive patient. If the salt intake is high, he is going to be a hypertensive. If he is obese, he is probably more likely to be a hypertensive. If there is a family history of hypertension in the family, he is more likely to be a hypertensive. If he is not physically active, has a sedentary lifestyle, retirement के बाद घर पे आराम कर रहे हैं, कोई काम धाम नहीं करना है, then he is more likely to become hypertensive than a person who is more physically active, has a more normal ideal body weight, or has no family history. So these are the social or the environmental factors which make a person more susceptible to being a hypertensive. That's it.
Thank you. So for the longest time, it has been said that more stress and anxiety also affects your blood pressure levels, causes you to develop hypertension early on. So isn't that contradicting that, you shared that people who are not elderly, people who are not into any profession, are at home, not working, also developing hypertension or are more susceptible. If they are relaxing more at home, shouldn't it be the other way around? Can you please help us clarify that a little bit?
Being resting at home, I don't mean to say that they don't work or they are not physically active. What I mean to say is the people who are not physically active, they don't walk around, they don't exercise, they are not. See, if you are not physically active, you are going to gain weight. You are going to gain. Dyslipidemia is more common in people who are not physically active. If you are physically active, if you go in for aerobic exercises or you go in for simple yoga exercises, isometric exercises, your muscle tone is improved. The venous return is taken care of by the muscle, and in that case, the heart only has to pump halfway through. The return is helped by the muscles to bring it back to heart. So if you are physically active, the heart has to pump only halfway. If you are not physically active, the heart has to pump all the way through the arteries as well as the veins. So that is what I mean to say by being physically active. I'm not meaning to say that they should be stressed. Being physically active does not mean that you are going to be stressed. You even by walking in the park, you de-stress yourself. By taking yoga exercises, you having a Zumba dance sessions, or swimming or cycling, all these physical activities to the extent that you can comfortably handle or are comfortable with are good enough to help you reduce your blood pressures. And studies have shown that if you are physically active with a moderate level of exercises, you can bring down your blood pressure by 5 to 7 mm without any other intervention. And 5 to 7 mm is a good number.
Got it. Thank you so much for clarifying that. So we covered the exercise and physical activity aspect very clearly, that being active in your older ages is very important to avoid other diseases as well as to avoid developing the risk of hypertension. Can you please help us understand what role diet and good food would play in keeping older people fit and healthy in regards to avoiding hypertension? It is a very common notion that runs in India that ज़्यादा नमक डालोगे तो BP बढ़ जाएगा. It's layman language that is thrown around. So can you please help us demystify and share some factual knowledge around it, and what good sort of diet should be followed for somebody who has already been detected of hypertension in the old age and wants to maintain healthy blood pressure levels?
That's a wonderful thing. Actually, you have rightly pointed out that ज़्यादा नमक मतलब ज़्यादा BP, which is a very commonly understood notion in the society, and to some extent that is true. You see, when you take salt, it has sodium chloride, and the sodium level of sodium in your body has to be in equilibrium in the osmotic milieu in your body. So the amount, if you increase the amount of sodium, body will, equally hold the amount of water so that the osmotic pressure remains normal in your cells in your body, inside your body. So if you double the dose of salt intake, the body will hold double the amount of water, in simple words. So that is how it is going to maintain an equilibrium between the sodium and the water. So when you take excess sodium, you retain excess water in your body, and that causes the intravascular pressure to rise and eventually raise the blood pressure. So that is why even there, all the guidelines recommend that you have to reduce the amount of salt intake to not more than 5 grams a day, which is 5 pinches of salt in a day. So that is the amount of salt which is good enough for a normal person. So that is how you reduce the amount of salt and to help you reduce the blood pressure. And again, the studies say that if you reduce the amount of salt you are taking by half, so you just half the amount of salt you have been taking, you reduce your blood pressure by about 5 mm more. So being physical active and reducing your salt by half, you reduce your blood pressure by say 5 plus 5 around 10 to 12 millimeters. That is how the salt intake helps. Again, when we talk about the diet per se, we would prefer to have as a hypertension diet. You must have heard of DASH diet, dietary endeavor in controlling hypertension. So in that case, in that diet, we have more of fibers, more of greens, more of potassium containing foods, and we reduce the amount of salt and oils in the diet. So DASH diet has been studied extensively and has been in vogue and has shown to improve the levels of blood pressure without any other pharmacological intervention. So exercise, a proper diet with low amount of salt, you don't totally cut off or eliminate the salt, you bring down the amount of salt, and a proper restful lifestyle.
Thank you so much. So let us move on to the other aspects. For example, if there is a person, elderly person who has not been detected of hypertension for long, has not come to show up or get checked, what are the adverse consequences that he may suffer from uncontrolled hypertension in his old age? What are the different signs and symptoms that can, come out, and so that all the viewers that are watching are aware, if they are feeling any of these signs and symptoms, they need to come to their doctor and get checked?
See, the consequences or the adverse effects of high blood pressure remain same in any age group, but they are more pronounced in the senior citizens because of the physical and physiological changes because of their aging process. Their blood vessels are more stiff as compared to a younger population. So in them, the chances of high blood pressure bleed will be more common than a younger population. A senior with a uncontrolled hypertension would be more susceptible to brain stroke because of hemorrhagic stroke rather than ischemic stroke. Similarly, he might be more, there might be more erythematous plaques in his blood vessels. So there are more chances of, blood or stroke formations in his seniors, in his older age. Again, his kidneys would compromise, so there are more chances of renal failure because of blood pressure in senior people. Similarly, there are more chances of retinal hemorrhages, heart attacks in seniors. But the overall evidence that have been seen are show that of getting all these adverse events is not very high as compared to younger population. So the chances of them having a stroke or a brain hemorrhage or a renal failure will be as common as in a younger population, but because of their physical compromises, they are at a little more risk as compared to a younger population.
Understood. Thank you so much. So it would be safe to summarize that hypertension, when uncontrolled, is equally deteriorating and worsening in all kinds of age groups, but in older age groups the effects may be more pronounced, considering their compromised health.
Very right.
Yes. And we discussed other aspects as well. We discussed that the other common reasons that could lead to uncontrolled hypertension in the elderly. We also discussed some factors that how hypertension not only is a big problem in its own, but in the elderly population can affect their other aspects of health as well. When coming on to the management of hypertension, we wouldn't want to get into very detail as the time is limited, but we would like you to touch upon the aspect of medication adherence, why it is necessary, and what do you see in your practice day to day. Is it easy for older patients to adhere to the prescribed medicines, or is it all the more challenging because of their age? Can you please touch upon that?
Yes, this is very relevant and very important, that we have to emphasize upon the importance of proper medication, timely medications, and to be consistent with their medication. It is so common that people are on multiple number of drugs because of their various ailments, and then many times they tend to forget or tend to skip upon a particular medicine just because it is a small medicine in size, or or an insignificant small tablet, or they have been taking so many other pills, so ye chhut gayi. So that has to be emphasized upon, that besides your multivitamins and a calcium supplement, which is it is important, but more important is your medications for blood pressure or for your renal problem or your diabetic problem or your asthmatic problems, which are more going to be more detrimental if not controlled or if not managed on regular basis. So this is a big challenge to make them understand, especially if they are cognitively not well normal. A dementia patient or a patient who tends to forget, is a mildly dementiated or mildly Parkinson's patient who is not who is unable to take their own pills on their own. So in them, or a depressive patient which is depression is very common in seniors. All these conditions makes them more susceptible to skipping their medicines or not taking them in proper manner. So it has to be especially emphasized upon which of all the number of pills that they are taking, which ones are the most important and has to be taken without skipping or without any neglect. And especially in my practice, I try to ensure that one of the family members or the caregivers, as we call them, are there, and I make them understand that these medicines of all these four, five, six, these three or these four are more important to be consumed and has to be taken on regular basis.
Thank you so much.
These things, and I might maintain the compliance.
Yes, we were about to talk about caregivers. So this is building on to the question that we asked, how important it is to have somebody, especially in old age, to accompany the patient to their doctor's appointments, also to take care of medication timely. Because most of the old people in their old age live by themselves. So if they are suffering from multiple different conditions due to weakness as well, they might not be able to take their medications or do their other activities properly. So how much important it is to have caregivers and their support and caregiver counseling? Is it important for a clinician to emphasize and explain well, not just to the elderly patient, but to their family members as well, the potential risk that might happen if the elderly is not being taken care of? And do you practice this in your practice? And what would be your advice to not just the patients that are watching, but also to other clinicians that would want to know?
Yes, having a caregiver or having a family member with my senior, especially the very old ones, the ones who are the aged ones who are more than say 75 or 80, or the ones who are not cognitively sound, who have a little dementia or are forgetful or very weak. I would prefer to have a family member, and most of my patients do come with their family members. And I do recommend to bring a family member or a caregiver who is constantly with them. He may be their servant who lives with them and takes care of them on day-to-day basis, rather than a son who is living far. So a person who is living close to them is a better person, is a better caregiver, and they knowing the ailments of they suffered by the senior is very important, and they can appreciate why medicines are being given and why a particular regimen is being followed, whether it is a lifestyle regime or a dietary regime or the medications protocol. So that always helps in taking better care of my seniors if a family member is involved.
Thank you so much. We discussed a whole lot of different options. Quickly summarizing in the end, can you please guide us through what is a regular protocol that is being carried out when person is detected of hypertension for their treatment? Do we start with pills, or there are other aspects as well, or can hypertension be controlled entirely by medication?
When I get a patient who comes to me for the first time with his blood pressure, high blood pressure, then I do go in for number of tests to see one, a physical examination wherein I check the blood pressure in standing and in supine position so as to eliminate the risk of orthostatic hypotension. Then I go in for the blood tests to evaluate his other parameters, his lipid profiles, his kidney functions, his echo, his ECG, so that I know where we stand when we start the treatment. Then pharmacological treatment with medications is one part. His lifestyle management, his dietary management is a very important second part, which is more important in taking care of the blood as compared to the physical medications. So they go in hand. His dietary habits have to be corrected. His exercise lifestyle management has to be done. Exercise has to be emphasized upon. What exercise can he do safely is again my job to tell them and to guide them which exercises he can do safely, which exercises he cannot do and should not do safe, which might be a detrimental to his health, looking at his other overall physical conditions, and then the judicious use of medicines, various kinds of groups of medicines, so that he gets the best results with minimum drug interactions and minimum drug associated side effects.
Thank you so much, Dr. Saurabh. With that, we come down to the very last question for you today, which is the concluding message to all our viewers. So as we conclude this discussion during the May Measure Month, what message or advice would you like to convey to all our audience that is watching regarding the importance of blood pressure monitoring and control, specifically in the elderly?
This is very important. We have to be consistent. You should be meeting your doctors on a very regular basis, be it monthly or once in 2 months. That's the maximum I would recommend. Regularly measuring your blood pressures, preferably if you are good enough to measure it on your own, you can have a digital home blood pressure monitoring system. Take a measure of it, keep a record of it, bring it down to me whenever you come to meet me, or to your physician in the other way. So you can, as a patient, you can always check your blood pressure once a week. Keep up it. Bring the record when you go to the doctor. Doctor is able to better control, better judge, and better titrate your medicines. Your blood pressure remain in good control, and you blood pressure monitoring is very important. It has to be done when they come to clinic. I ensure that I check their blood pressure on my own. I check them myself and correlate with the record that they have brought in.
I believe there was some network issue, and we hope to have Dr. Saurabh back. But as we are down, yes, I believe we have him back.
Hello.
Yes, are you able to hear us?
Yeah, I'm again online. I think you are getting me.
Yes, we are able to hear you.
So blood pressure monitoring is very important and has to be done on regular basis. If possible at home, if not possible, you can always come to your physician, ask them to check your blood pressure. At least once in a month is good enough if you're going to your doctor. If you're doing it at home, once a week is fine.
Great. Thank you so much. Thank you so much for Dr. Atulya Saurabh for taking out time from your busy schedule and imparting us with wealth of knowledge and information. Thank you. We also like to thank our partner, Servier, for partnering with us on this amazing initiative for generating awareness around hypertension for the Hypertension Awareness Series. Thank you so much. We would also like to thank our viewers for staying with us till the very end. We hope this session was as informational and insightful to you as it was to us. Thank you. With that, we sign off now. Have a nice day. Stay happy, stay healthy. Bye-bye.
Thank you.